All right, let's get started here on our last little segment, but I want to start first by having Jean make an announcement related to World Patient Safety Day.
Thanks so much. Yeah, just to let everybody know that World Patient Safety Day was started in 2019, and it was just an announcement and events around patient safety. In 2020, the focus was on COVID and patient safety for healthcare workers. And in 2021, the theme is maternal newborn health safety. So really focused around the conditions that improve the health and well-being of infants and moms, so that we have a healthy delivery, particularly around disparities. It is September 17th, and I would love to propose that we ask Health and Human Services to recognize it and be a part of it. It is going to take place, the first day of it, or the announcements, will take place in the United Nations. And it is a global event. Every city shows their monuments. So the National Monument in Rio, the Jesucristo, they will all be orange in memory, in recognition of World Safety Day. So I've got a PowerPoint I could happily share with folks. They haven't come up with exactly the theme or slogans yet, but it will be around maternal and newborn health.
Good. Look forward to more information, and we'll see about letting the secretary know that the U.S. should support this effort.
Thanks.
All right. So we have about 25 minutes to sort of talk about next steps related to our recommendations. We'll get a quick report back from the various work groups to see what kind of input they had, and then I wanted to try to find some way to set some priorities and decide how the next steps should go. And there were in the data work group, which I attended, Jean Connery was there and Paul Wise was there. And we did not have any, major changes related to the data, but there was a discussion about a large number of recommendations, and we may need to we should prioritize those, and we may need to consolidate some of the recommendations and set some priorities. So we will do that as we get near the end of this little session here. And wondering now about the equity work group. What kind of discussion did you have, Belinda?
We had a good discussion. We actually did not make it all the way to the end. I'm trying to pull my notes up really quick now, but we made it through most of it. And I was taking notes while we were going along. A couple of areas that we looked at was more general around making sure as we have the data, as we have the information, that we're being consistent throughout the document by placing the woman first and then the infant, because the woman is needed for the infant. So that's just some minor language. We wanted to strengthen the language to make sure there was at least one support person allowed beyond a doula during pregnancy, labor, and delivery and recovery, that time frame. We know that in many of our states and within many of our hospitals that doulas were not allowed to be part of the care team. So we were just trying to strengthen that language, and I can send it to you. We also, under the area around data and surveillance, we added that we also needed training to increase the comfort level on asking race and ethnicity questions, but also started out by explaining to the individual why you need that information, because we just want to strengthen that area. As we move forward, we spent some time talking about the CMS language, the language around extending Medicaid coverage for at least 12 months postpartum. I think what we have currently is for women following a Medicaid financed birth for 1 year after pregnancy, that, the eligibility would continue. We went down the road of the conversation, well, what about if the individual had a miscarriage or a loss? Would they be covered in that 12-month period as well? And so really trying to think through that language a little bit.
You'll notice that in the document we have, I tried to get end of pregnancy as opposed to after delivery. which would include, any other, the end of pregnancy, regardless of the reason.
Good point. Thank you. And then we also wanted to make sure under the area for systems enhancement and financing of care that we talk about broadband internet service, but we added language and a method to access telehealth. So they may need support with a phone or computer or something of that nature. So we added some language there that we didn't think it was just broadband, that at times it was still a broader access issue. In that same area, we added a 6th bullet under Healthy Start. We put language around expanding or supporting group prenatal care because we've seen some good research on how it impacts birth outcomes as well, especially with communities of color. So we added in group prenatal care, and I'm working on some language for that. We made a change on the workforce development under the certified nurse midwife and certified midwives language. We basically changed it to say increase the number of racially and ethnically diverse nurse midwives, and expand access to them and allow them to practice to the full extent of their master's prepared education, clinical training, and national certification in all states and all facilities. And that's when we started the conversation around we needed to capture data and surveillance on enrollment and graduation by race and ethnicity. We started it talking about nurse midwives, but we feel like it's a broader issue that it should be captured in all of our health or allied health professions. We need to figure out a way to capture that to see if we're even able to diversify our workforce. Are there issues with who's getting enrolled, who's getting admitted, and are there challenges with graduations with certain populations? So we started that discussion. We did not finalize it. Then we added some language around increasing the workforce and trying to strengthen the work with rural hospitals because we're seeing hospital closures in rural areas, OB unit closures in rural areas. And then we're also concerned about, some of the issues around transportation, especially, whether specialty care, whether someone shows up in the emergency room and they need to quickly get to the next level hospital. I think there was an example, do they have access to a helicopter if it's really quick? So we did add some language in there around transportation. And then we ran out of time.
You covered
we did under the last data and assessment, we did separate. We wanted to be clear that for bullet 1 that we meant maternal mortality review and infant mortality review committees, that it wasn't a combined committee. And that's what we thought it was, but the question came up, so we're just trying to clarify it. And so I've got all kinds of little notes and we'll forward them to you.
Good. Yeah, if you could get those, that would really be helpful.
And I don't know if anyone else, because we had a good group. I know Paul was in the group, Cheryl and Rachel, and I'm losing names, but it was many other people that were in the group. And I mean Paul Jarris.
The other Paul.
Otherwise known as the other Paul, okay.
The sweaty Paul right now. All right, Steve, how about you and your group?
So our group included Tara, Colleen, Lee Wilson, I think Lily Bastian from ACNM, American College of Nurse Midwives, and Lisa Satterfield from ACOG joined us briefly as well. Belinda covered a lot of the things. Two of the, I think we have to make sure that we do not forget the challenges of rural healthcare, which certainly impact the racial equity stuff, but just in general, anybody who lives in a rural area and relies on a critical access hospital. So I'll also send these notes too. We also discussed a bit about the opioid, the care of opioid addicted mothers, and then subsequently the newborns with neonatal abstinence syndrome. And Colleen had some good input about that from her neonatal perspective. And Lee gave us some information just regarding the contact person at HRSA who has a lot of information about that. So I'll just kind of pull that together as well. we talked a bit as well about, the training of neonatal nurse practitioners. I mean, it gets into the weeds, but the Dartmouth study on on neonatal and neonatal hospital beds, neonatologists, and the availability about a year and a half ago, it was quite interesting. We have a fairly robust supply of neonatologists and neonatal beds. We don't have as many neonatal nurse practitioners, so that should also be a focus. And HRSA does have its Bureau of Health Workforce analysis that we'll access to try to look into that a little bit better. Belinda also mentioned the group prenatal care option, and it is extremely helpful for mothers from various communities, and they're usually not just focused on one community, or sometimes led by someone from that community. But I think we have to, make sure that we include that. Talked a little bit as well about how somewhere in our document we should just acknowledge that the Affordable Care Act did provide funding for the Strong Start study, which was completed and had a really fairly significant outcome that suggested that midwife care, the midwife model of care, and an option of birth center care really did decrease racial disparities and improved outcomes significantly. And we've discussed it before, but I think whatever we send to the secretary should just be a reminder to take a look at the Strong Start study. And I think the new pending CMS administrator, she's very, very knowledgeable about that. So that's a good thing. And then finally, I would say, as part of access, we do talk about, we have all these various services that we want that we would like to have provided to improve care. But somewhere in our recommendations, maybe not this time, but maybe down the road, we have to look at the financing and how maternity and newborn care is financed through Medicaid in particular, because such a large portion of Medicaid, such a large portion of Medicaid maternity care is provided through managed care organizations, some of which are for-profit and some of which are nonprofit, but all of which have the ability to change things. And I think CMS has the ability to push some changes. So we need to kind of look at how is that financing working? And there's in general a movement away from fee-for-service to episode payments, bundled payments that I think will have an impact. So I think we should just keep that on our radar, and I'll include that in my notes. And that's about it.
All right. Thank you. And I would appreciate it if get the notes in each of those. And then how do we move forward with coming up with something by June? If you noted that this was what I put together last night was 8 pages long, lots and lots of recommendations. So my belief is that that many will sort of overwhelm any reader. And I think I don't know if people believe, if there's a consensus that we should probably try to consolidate and narrow the scope a little bit and streamline it so that it is not so overwhelming, but that's the sense that I have. And so I think there are 2 approaches to not lose anything, but also narrow it down. One is I believe that we can put together a more comprehensive document that can be part of what MCHB is working on for their with the report that they're writing, and we could put all of our recommendations in there with a lot of the supporting area, but then pull out from these set of recommendations a smaller subset that we could highlight for the secretary. And I would like to get your input on ways that we should prioritize. But first, before I get to that, is there a sense that we should try to prioritize and limit the scope of the letter that we sent to the secretary to make it more actionable? Just your thoughts about that.
I think,
I'd agree. I think, oh, sorry, Steve.
go ahead, Colleen.
No, I think it's grown so much. We're trying to cover all bases, and I think it's lost some of the original focus. And so I agree, maybe paring it down to things that are more like directly actionable instead of trying to cast a much wider net that might be beyond the scope of the purpose of this committee. So I think you'd probably have more effect if we narrowed it down a little bit instead of all these extra pieces being added on.
All right, good. Steve?
Yeah, I was just going to say, I think a letter that kind of summarizes everything, because we do have probably 4 or 5 major, general areas, and then just reference in accompanying document with maybe a little bit more specificity that for recommendations.
Yeah, so what I thought I would do is get the input from the work groups that you've got, and then modify the document that I sent around last night, adding things and changing things, and then sending it out to the group with sort of a poll to say, how would you prioritize some of these things based on the importance of the issue, and the kind of impact that it could have, whether or not it's actionable, the pragmatic piece of that. Is there an opportunity now that we would not have? What's, focusing on the opportunity, and then is it something that is unique to SACIM? It's something that no one else would bring forward and that we would recommend. So, sort of develop a poll to get your sense from the committee of how to prioritize, based on the importance of the issue, the opportunity that's there, whether it's actionable, and the unique characteristics of it. And then from that, recraft the document or a little letter based on that, which would mean also consolidating some of the things that we could do, because my guess is that many of these could be worded in a different way to narrow it down to a paragraph as opposed to 6 paragraphs on the same issue. Does that sound like a reasonable approach?
Yeah, it does.
Sounds good to me.
All right, and then I would actually, and I'm looking to the work group chairs and co-chairs to help actually with some of that prioritization. When we get the feedback from folks, come together and say, all right, how do we put this together into a workable document, and then formatting it from that. So I really do look forward to working with the work group chairs. And if anybody else wants to be part of that, that would also, that would be cool. All right, anything else on this? So that's the plan. I'll get feedback from the chairs on the work groups, redo the document, set up sort of a scoring sheet or, issues, and then have you prioritize them from your perspective, sort of, I'm not sure how high, medium, and low priority, and then work with the work group chairs to recraft the recommendations and get them out to you as quickly as possible before the June meeting, so that you have time to get some feedback on that, and then try to finalize the letter in June and the larger document that would support all of the work that we've talked about sometime in July or August. All right. Anything else? Any other comments?
What are your June dates? I didn't see that the date was set.
Vanessa or Lee, I don't have it right in front of me. I think it was like the 23rd and 24th of June or something like that.
Yeah, that's correct, Ed. It's Vanessa. It's June 23rd and 24th, which is a Wednesday and Thursday.
So then how, just like looking towards the rest of the year, because I mean, that's 2 months away. So how often are we chartered to have meetings?
We're hoping to have 3 meetings a year.
So June is our 3rd meeting then?
We're going to probably have another meeting in September. Part of the tight timeline here was because the contract with LRG ends at the end of June, so they have to get all of their work done by the end of June. So that squished the time frame that we've got. And I'll be working with Dr. Warren and Lee and Vanessa on, looking at the schedule for the next year, which I'm hoping some of our meetings will be able to be in person, once we get through the COVID thing. But there'll be try to equally space throughout the year, more or less 3 times. So Lee, any feedback on that?
Yeah, just a little bit more. So Colleen, the concern with the timing, aside from the fact that LRG is ending its contract, that's the issue there isn't that we couldn't continue the work. It's that we've got an organization that has been involved in assisting us all along the way, and we have to recompete the contract. If it's not LRG, then we lose some of that internal corporate knowledge in the development and writing of the product. We are, as Ed said, recompeting the contract. We're hoping to have a new contract in place this summer. We are looking at a September date, and we have put in a proposal for a December/January date for the meeting after that. I do believe that for this coming year, we had proposed possibly allowing for 4 meetings, with 2 being in person and 2 being virtual, with a certain degree of flexibility around that because of what's going to happen with the COVID and travel situation.
And I don't know what LRG is.
I'm sorry, LRG is just a private company that provides the meeting logistics services, the writing services, transcription. They're the ones who contact you and send out the briefing book and those materials. Sorry.
So if you had a meeting in June and September and December, that'd be 5 for the year, right?
June, September, that would be 4 for the year.
Because we had one already, and then this is 2, and then June is 3, and then September is 4, and then December is 5.
I'm sorry, April. Did we have one in January? Or was it December?
Yes, no, we had one in January.
The plan is for 4 this year. Maybe it would be January then. I don't recall. But what we tried to do was for this year and last year to have 4, because we have the resources for it. It may get canceled or pushed, but that's what we're trying to do.
Well, and the thing is, and were the dates for June, because I don't think we were asked as a committee if we were available. Were we going to discuss those dates at all, or is that set in stone?
It was, I just chose, we didn't want to get close to the 4th of July weekend. I did get some feedback from folks who said that they weren't available the last week of June. So trying to spread it out as close to the end of June as I could make it with those concerns. And so decided the 23rd and 24th made the most sense. I didn't poll the whole committee.
I think for future, it would really be helpful if we could poll the whole committee before. I mean, our committee isn't that big. So if we could just poll members, and I understand that we might not be able to get 100%, but that would greatly be appreciated.
So one question I have, thank you for, yeah, we can try to do that. This meeting was 2 half days as opposed to our January meeting, which was, 2 full days. How did this work from your standpoint? Too
Much
short,
better.
too long at a time, just right?
No, this is better.
Much better.
Yes, I agree.
Okay.
I also appreciated getting the information about a week in advance. So thank you for doing that. That was helpful. Like the recommendations, so we had time to read and prepare.
Yeah. Okay. All right. So my guess then I'll be working with the MCHB folks, but it'll most likely be 2 half days like we did this time with the June meeting. All right, Lee, I think it's time for public testimony.
Okay. Thank you to all of the individuals who, well, we put out a notification for public comment. We did receive public comment from one individual. I don't want to thank multiple individuals. It was a comment that was provided in writing, and we will make that written comment available for the record and for your review. I believe it was in the briefing materials and briefing book. There was no request for a verbal comment or for somebody to read any public input or comment, although we have historically in the past provided an opportunity for individuals who might be on the line to make a comment or a statement if they are interested in doing so. So I'm going to offer about 30 seconds for somebody, anyone on the call on Zoom to raise their hand. We will have somebody from LRG who is monitoring the hand waves to see whether or not there's anyone who would like to make a public comment, and we will allow an opportunity for that. Please raise your hand if you have an interest in making a comment. Alrighty, I've given 30 seconds. Absent any raised hands, we will move on with our discussion. Thank you, Ed.
All right. And then we can turn it right back to you again for the organizational discussion, or to Dr. Warren. I'm not sure who's going to walk us through the charter and the members and bylaws and things like that.
Think that is either Lee or Vanessa, right?
Yes, Vanessa, could you, we're just switching through our list of activities here. Vanessa, can you identify the topics? I'm pulling up my chart here.
Yep, sure. We wanted to provide some updates on the bylaws, the charter renewal, new member nominations, and discuss plans for the June meeting, which I know we've gotten a little bit into.
Okay, so as it relates to the charter and the bylaws, we have sent our bylaws forward. As we had discussed previously, they have gone through a review internally within MCHB. We have gotten the input from the advisory group, from the advisory committee on the proposed charter. It is not unusual in the transition of an administration for them to want to be as engaged as possible in the development and review of those, the bylaws. And so we have provided that input to our Office of General Counsel, and it is currently with the Office of the Administrator for review. We're expecting to have the sign off or approval from the Office of the Administrator relatively soon. And we have given it a secondary review with the intent of trying to ensure that any input from the charter or changes to the charter would be parallel to the bylaws. So from the conversations that we've had with Ed and previous conversations with all of you, we spoke about the proposed changes, and it appears that they will be running relatively in parallel. Although I do know that there will be further conversation about recommendations for the charter coming forward. Our hope is to have the charter submitted shortly following this meeting for review through the process. The charter is something developed by the department and approved by the department. So we are accepting your input, although that's going to wind its way through the process within the department. The need is for us to have the charter completed and signed off before the end of the period of operations for the committee to reauthorize the charter. Once it expires, we would have to go through the whole process again. So we are kind of on a fast track at this point because the administration is having a lot of these come through at the same time that they're doing hiring and transitioning. So are there any questions on bylaws and charter?
Or any input on the charter? I don't know if if we're going to make any, I guess we don't make the changes, that the administration makes the changes in terms of the charter, but we're taking input from us. Any thoughts that people have about things that they would potentially like to see in the charter? The one
And on
thing,
that note, go ahead, Ed.
the one thing that I'm not sure how we get this into charter is the importance of the ex officio members, and are they the right of ex officio members that are on the committee, and how, and how to engage them, and because a lot of the other issues that we deal with, particularly the social and environmental issues, are impacted by other agencies. And is there any way in the charter to sort of highlight the need for that input from our ex officio members?
I think I would encourage you to make recommendations of those organizations that you would be interested in having either be ex officio members or to be informed of what we are doing. We can take that information and sort through who would be sort of a standing committee member, similar to what CDC is, or whether it is something that's more situational and we keep them informed in the process. We do run a lot of other working groups and committees, so we can tap them for whatever the needs are based on what the agenda is for the committee and what the priorities are. I do want to recognize that we don't want to have a number of ex officio members that appears to dwarf in some way the public input that the advisory group is receiving.
Okay. Other thoughts from other members? Okay, if you do have any thoughts, we get them to me or to Lee as quickly as possible, because they're going to be acting on this pretty soon, because they have to move this forward, and it always takes a while to get through the bureaucracy.
Okay. So the next topic that we had for discussion was new member nominations, and I wanted to give you an update that the nominees have moved. Have been moved forward, and they are going through the review process. We've received good feedback. As I mentioned, I believe 2 meetings ago, we received a very robust list of nominees or set of nominees through the public comment mechanism through the Federal Register notice. And we've put together what we feel is a very robust working group that ensures a number of different priorities. 1, broad representation. 2, our desire to have sort of an orderly transition of positions on the committee through staggering of appointments, and making sure that that representation is both professional as well as demographic. So whether that be location around the country, male, female, gender focused, and particular interest areas, so that we're covering all of the fronts. Those categories, some of them are outlined in the Federal Advisory Committee rules, and some of them are the result of feedback that we've received from you, the committee. So we are going through that process. We are hoping to have that resolved this summer, with the idea that we can bring on the committee members before current terms expire, without having to extend people further. It would be a good opportunity to transition with the transition of the charter. I'd also like to say that the process is a lengthy process and takes about a year under normal circumstances. And so beginning in June, we will begin the process again of setting forward another set of nominations. Hopefully we'll get some input from the department on that so that we can begin the process further. Any questions on the nomination process?
So How is it decided at the secretary level? I mean, is there a committee that works on it, or is it an individual, or how does that work?
So the committee nominees go through the agency, through MCHB, through HRSA, up to the department. At the department level, there's a good bit of work that goes on. The ethics officials get involved to make sure that there aren't any conflicts of interest at various stages along the way. They look for any vetting concerns, that whether or not an individual has been working with a particular organization that might in some way disqualify them. There are people from the Office of Legislation, Public Affairs, and other places to look at priorities that the administration may have set out. That whole vetting process occurs with what is called the Office of the White House Liaison, and then the various staff offices at the department. Once that is finalized, there is communication between the Office of White House Liaison and the folks at OMB and the Domestic Policy Council to make sure that it is in keeping with general administrative procedures around the Federal Advisory Act and any political priorities that the administration may have. Sort of a Byzantine process, sort of a black box. I'm not sure all of the priorities that go into that decision-making from one administration to the next. We are now at the stage of it being up at the department, wending its way through these various steps, and we're hoping to hear in the next couple months.
I bet you the committee members didn't realize how much vetting they had in order to get to where we are.
Yes, they are very thoroughly vetted.
Yeah.
And we do take, and I do want to just say that we're being very deliberate about not saying specifically where something is in the process, A, because sometimes we don't know, but B, because individuals are weighing in, and some of these are rather private matters for someone's involvement, or if they've got a stock fund or something that may disqualify them for various reasons. We don't want to create a situation where someone is identified as having been pulled out of the process because of something maybe of a personal nature.
No, I fully understand. As my understanding is that many of the members of the current SACIM group, our terms end next June, and others that might be another year later or so.
Mm-hmm.
And the thought was to stagger some of the terms so that there's not just a full-fledged, movement away from the committee and a whole new group coming in. How do you see that happening in terms of, right now we only have like 6 members on this call, and we need a bigger committee, but to get up to 21 all at one time would give this huge bolus, which would have again, not allow sort of staggered terms. So how do you plan on doing the staggered term issues?
So we have presented options forward. We don't get to necessarily make all of these decisions. They may accept what our recommendations are or adjust. One of the things, we're pursuing a number of different options. One is for individuals who are on the committee. An option is to offer some extension for a short period of time, not for necessarily a reinstatement for a longer period of time. That would require us giving them a nomination and having them go through the process again. But let's say we would take you or Belinda or somebody else and say, could we extend them another 6 months or a year to assist with the staggering process? We are also looking at making nominations, some individuals for 2 years, 3 years, 4 years, whatever the option is, to try to stagger this process going into the future. There will be a couple years that it may be unavoidable where we have a relatively large number of people rolling off of the committee. And some of that we may not be able to control because there are just some individuals who are done and they don't have the flexibility to extend further. But we are pursuing a number of different ways to try to balance the rolling off of individuals and the rolling off of not getting the same type of individual, all of them rolling off at the same time. We don't want all the pediatricians to leave at the same time and then have a new crop of pediatricians, that sort of thing. So we are trying to manage it from many levels.
And how is the chair selected? And I've been acting chair during this whole time. I'm not officially the chair. I'm just the acting chair. How does that position get chosen and verified?
So it is similar to this process. We would make a nomination or a recommendation of an individual to be the chair. Again, it is just usually what we do is we don't recommend one individual. We would give a slate of individuals, whether that's 2, 3, 4 individuals that have particular characteristics, both from, soft skills, leadership skills, as well as credentials to lead, as well as possibly demographics, if those are important or not important, to put that forward. Selecting the chair is much less, I would say, or I don't want to say it's less in our hands, so much as it is something that is discussed on an individual basis more than a slate of committee members.
Okay, good. Any questions from the group?
I put it in the chat, but are all the terms 4 years? Is that right? Or is it different?
So in general, the terms are 4 years. We have proposed that there would be options for that so that we don't have, right now, the number of vacancies totals 11. I'm not saying that we're nominating 11 right now, but we don't want to have a cycle where we have what would be half of the potential membership rolling off in any given year.
Any other comments or questions?
Gripping policy here, guys.
All right, anything else, Lee?
The final thing is just a discussion about the June meeting. The June meeting proposed dates now are June 23rd and 24th. We're proposing a virtual meeting. Those are, given the difficulties with June, those are relatively solid based on input that we have received in discussions that we've had. Tara, I heard your point, and we'll make a note of that and ensure that there is more discussion about the options for dates. And I will apologize for any shortcoming on the part of our staff here in that process. That being said, it is not final. If we do need to change, if there is some reason why we absolutely must move it, please let us know. If we want to have that discussion now, that would be terrific. If not, then it has to happen in the next couple of days.
I appreciate that, Lee. I was wondering if we could shift it just to Tuesday and Wednesday, but if not, I understand, because there's been a lot of, if those 2 dates work for a lot of people, then it should be kept. I'm just throwing that out there. If there is some flexibility with shifting it to that Tuesday and Wednesday, June 22nd and June 23rd.
Okay. I am not at liberty at this point to say one way or the other. I think what I'd like to know right now is if people have strong feelings one way or the other, please lodge them here, lodge them now, whether either verbally in the chat. However, we will make note of that. We will go back and explore what the options are. It may stay the way it is, but I do want to say that we have the ability to move if we must.
All right. Yeah,
Can I just ask, like, in the future, also, if you know the date, to kind of let us know as early as possible, because my clinical schedule is made months in advance. So it's helpful, because then I have to ask people to cover for me and all that. So
that is totally acceptable and should be expected.
very reasonable. Yes. All right. Anything else, Lee? That should do.
That's all I've got. You've had more time with me than you wanted.
No, that's always appreciated. All right. I just want, we've got a little bit of time. I just want to take some time for reflection, and I'd like to find out from you, what worked in this meeting? You know, what's one thing that worked? And what takeaways do you have from this meeting? To get a sense of what we've accomplished and what we haven't accomplished. And actually, I want to start with the MCHB staff. You know, what worked and their takeaways before we hear from the SACIM members. So, Dr. Warren, what were your takeaways from this meeting, and what did you see that worked well?
So I think at a high level, the format seemed to be better for keeping folks engaged and having better participation. I feel like you all got to more concrete to conclusions if we think about the recommendations, because there are some things that have been sort of brewing over several meetings, and it's time to move some of them along. And so I think you all got to a good spot there. I appreciated the way you all and the staff structured the breakout, so it gave people the opportunity to get to multiple sessions yesterday afternoon. That seemed to work well. And I just want to give a shout out to the staff. I think, I don't know if it was mentioned earlier, but we've got a lot of folks deployed to work both on the border and in the COVID response. So folks are wearing multiple hats right now, and I just want to give a shout out to the staff who are all wearing multiple hats and doing that beautifully.
Thank you, Michael. Lee, your takeaway.
Thanks, Ed. I'll echo Dr. Warren in saying that I think that I was incredibly pleased with how quickly the committee was able to come together and make some decisions, even some of those decisions to disagree or not decide on certain things. But I was skeptical that we would get as far as the committee has gotten in the 2 half-day meetings. I think the half-day approach works very, very well. I think the Zoom format works better than the Adobe Connect format was working before. Finally, the one thing that I am longing is something is lost in not having the ability to sit and have lunch with folks and have conversations separate from being at the table. And I think we can't lose that in the process, because some of the real brain work goes on during those conversations.
Right. And Vanessa, I know you're usually behind the scenes, so
yeah, I'm just relieved the technology worked, but yeah, I think my takeaway was just a deeper appreciation for all of the hard work that goes into your participation and active engagement in these meetings. It was just, as Lee and Dr. Warren said, very clear how much time and just effort you all put into reviewing the recommendations, editing, thinking through what really made sense for HHS. So I just felt, I clearly saw that, and that was sort of my big takeaway, just how much work, again, all of you did in preparation for the meeting and over the 2 half days. So thank you.
Good. And Dr. Barfield, you're the ex officio member who is most engaged in this committee. Your takeaways?
Yeah, I just think that, first of all, I just have to give a lot of credit to the committee members. I've had a chance to observe various committee groups, and I would say your group has been incredibly engaged and actively involved in really thinking through this whole process in a very thoughtful way. So it's really exciting to see the things that you're focusing on, and particularly given this time where the opportunities really are to move the needle on maternal and infant health.
Thank you. All right, Paul Jarris.
I appreciate all that you put into these meetings and organizing it, and a lot of extra work that you can clearly tell thought and then preparation, getting this out to ahead of time, doing the editing. So I really do appreciate that. And for me, I really value the opportunity to learn from everybody on the committee. So thank you.
Right. Tara, your takeaway and what worked?
My takeaways, I think that the format this time was really, it allowed us all to engage at a deeper level. And so I really appreciated that. And I know that there's a lot of work that the that the subcommittee chairs do in advance of us meeting. So I just, I do appreciate that. And I do like the way that we had those breakout discussions. I guess my only thought was that we were kind of, you know, we were kind of put into different breakout sessions. It might be fun to just kind of at some level be involved in, you know, every aspect that was in the discussion, because or maybe have some input of which ones we thought we might want to be in if we felt really passionate about some of them. But overall, I thought it went really well. Thank you.
Colleen.
Yeah, I like the format. I felt like it was easier to have a discussion. I think it goes back to, I do really appreciate the presentation, but it's not as much discussion based. And I think one thing with presentations is there's always going to be kind of a point that the speaker is trying to make. And so I think it's always helpful when I'm putting a presentation together to say, okay, well, there's probably another side, at least one other side is what's the other side? And this is what might someone who didn't agree with these opinions might say. So like sometimes I think like the gatekeeper that allows the presentations is really holds a lot of power, because it's kind of like what presentations are allowed to be put forth is the only information that we see. And the presentations have so much information and well studied, and like I think it's great, but there's always, you know, what do they say, 3 sides to every story. So sometimes it would be kind of helpful to have, I think that's why this worked better for me, because people could ask more questions than a didactic kind of lecture saying like this is the absolute truth and this is kind of the truth as it is. So I think a mixture of both. I think last time was a lot more presentation based, and I think maybe a mixture hybrid of the two works well. I still don't exactly know like how, I don't know the format of like how the presentations are chosen, because I know like some people have tried to get speakers in and nothing happened. And then, so I don't know if that could be like a little bit more transparent on how you select what people are giving the presentations, because that kind of flavors the whole meeting. That would just be my advice for the future.
Thank you. Steve.
I liked the shorter meeting. I mean, the other times it would take almost a few hours, and I know many of you have worked harder on it than I have, but 8 hours is overwhelming. So I like the half day, and I appreciate the work, Ed, you've put in. I also appreciate the work that all the career people at MCHB and Wanda have put into. I learn a lot just by being here.
Good. Jean.
I want to echo what Steve said, because I think the work from all of the career leadership here makes all the difference in the world for us being able to go forward and get some insight and understanding. And then Ed, the fact that you take all the notes at the end of the day, no matter how late it is, and reformat it and get it back to us is greatly appreciated. So thank you for your leadership for all of us.
Well, you know, what works for me is the fact that we've got some really talented and experienced people on this committee. Just the expertise that you bring to this and the commitment and the willingness to work is really, really remarkable. So I appreciate that. And I really liked the fact that this meeting wasn't about presentations. I think we need to have more of the time when we just talk and debate and discuss. Presentations are important, but you know, we had those for several meetings and we never really had a chance to get into depth in some of the conversation. And the fact that you all participated and that we set it up in terms of a way that we had a couple of different breakouts, three breakouts where you had a chance to talk. I think that works, because I like hearing your voice. Just like I do like the voices of the community at the beginning of our meetings. And the 2 doulas that presented on Monday morning or Monday afternoon, I thought were really powerful. I mean, we did have a video, which I thought was very powerful, but I'd love to have more voices like that and actually build in sort of a strategy about if we're going to be talking about some subject during the meeting, have some voices from the community that reflect the stories around that topic. And I would hope that it would come not just from the people that I know or the connections that I have, but come from the connections that all of you have. And I do like and what I think works is that we did have a sense of urgency. I mean, we have an opportunity now to make some recommendations to a brand new administration that has a lot of resources coming down the pike, that there are a lot of things that are, you know, front and center in terms of maternal and infant health and disparities that we can actually have an impact on. And I got a sense that people accept that urgency and really do want to come up with something that's doable and practical, and not just wait for, you know, 3 years to put together a comprehensive report, but get something out. So I'm hoping that we can stay engaged over the next couple of months, get something that we can finalize in June and have an impact on the health of moms and babies, you know, moving forward. And as I say that, moms and babies, I laughed when Belinda said, you know, we should put mothers, you know, pregnant women and infants. As an English major, does that mean pregnant women and pregnant infants? Pregnant infants, yeah. So I always say infants and pregnant women, so there's no confusion. But that, like I say, I have my own little internal quirkiness. But anyway, given all that, thank you very much for your input. I look forward to your continued input, your continued partnership in trying to make a difference. And I will be getting back to you as quickly as I can after I get all of the information from the work groups. Do a little poll, then reconfigure with the chairs of the work groups and get something back to you again. And I hope we get it far enough in advance so that you can have, we can maybe even have some email conversation prior to our meeting in June. So with that, I say the meeting is adjourned. Have a great rest of.
Thanks,
Thank you.
Ed.
Thank you.
And I appreciate